Health Maintenance Organization, HMO, and Point of Service, POS, are two distinct types of health insurance plans, each with its own set of features and characteristics. Understanding the differences between them is crucial for individuals when choosing the most suitable plan for their healthcare needs. HMOs operate on a network-based system, requiring members to select a primary care physician, PCP, from within the network. The PCP serves as the gateway to all medical services and referrals to specialists. In an HMO, coverage is typically limited to services provided by in-network healthcare providers, and obtaining care outside the network may result in higher out-of-pocket costs. On the other hand, POS plans combine elements of HMOs and preferred provider organizations, PPOs. Like HMOs, POS plans necessitate the selection of a primary care physician, but they also permit members to seek care from out-of-network providers. While out-of-network services are covered, the coverage is generally higher for in-network providers. POS plans grant more flexibility compared to HMOs, but may entail higher costs for services obtained outside the network. In terms of cost, HMOs generally have lower premiums and out-of-pocket expenses than POS plans. However, POS plans provide greater flexibility in choosing healthcare providers, making them potentially more appealing to individuals who want a balance between cost and flexibility. In summary, the primary distinctions between HMO and POS health insurance plans lie in their network structures, provider choices, and associated costs. HMOs prioritize cost-effective in-network care with a designated primary care physician, while POS plans offer a middle ground by allowing members to venture outside the network for care at an increased cost. Individuals should carefully evaluate their healthcare needs, preferred provider choices, and budget constraints when selecting between these two types of insurance plans.